When auscultating for the aortic valve, you want to go to the second right intercostal space. Auscultation of the pulmonic valve will be at the second left intercostal space. The auscultation for the tricuspid valve will be at the fourth left intercostal space. When auscultating for the mitral valve, you want to go to the fifth left intercostal space at the mid-clavicular line. The blood supply for the heart is going to be coming from the coronary arteries. We are going to have a right coronary artery and a left coronary artery. It's important to know that the right and the left coronary artery are going to be coming off the aorta. And you want to know that these coronary arteries are going to be receiving blood supply during diastole. Now we're going to talk about the branches of the right coronary artery. The artery to the SA node will be the first branch coming off the right coronary artery. You want to notice that it's going to be branching and going upwards, and it's going to be giving blood supply to the SA node. The right coronary artery will continue, and the next branch it's going to give will be the right marginal artery. All this time, we've been talking about the branches that are going to be within the anterior surface of the heart. Now let's talk about the posterior surface of the heart. We are assuming that this patient is going to be right heart dominant. Therefore, the posterior descending artery will be coming from the right coronary artery. I will spend some time talking about the posterior descending artery. This is going to be very, very important, so you want to know the high yield facts regarding this artery. Regardless of whether the patient is going to be right heart dominant, left heart dominant, or co-dominant, the posterior descending artery is going to supply the AV node, the posterior 1/3 of the intraventricular septum, posterior 2/3 of the posterior ventricle, and the posterior medial papillary muscle. Therefore, in this example, this patient is right heart dominant because the posterior descending artery is coming from the right coronary artery. In a patient that's going to be left heart dominant, that means that the posterior descending artery is coming from the left coronary artery. In the patient that's going to be co-dominant, it means that the posterior descending artery will be supplied by the right coronary artery and the left coronary artery. Now let's talk about the branches coming off the left coronary artery. The left circumflex will be supplying mainly the lateral aspect of the left ventricle. Left anterior descending artery will be supplying the anterior surface of the left ventricle, 2/3 of the interventricular septum, and the anterolateral papillary muscle.